A lot of the research we've done today is really focused on where violence occurs, such as a neighbourhood or pub or nightclub or wherever. What we're beginning to be able to do now with big data is start to think about not only the where but also the who and the why. So I am Professor Simon Moore, I'm Director of the Violence Research Group. So the interest in violence really comes from the fact that those who are seriously injured end up in the NHS. It's a preventable event in many cases. If we are successful in reducing the amount people drink, and that results in reducing the levels of violence, we will see that reflected in the burden on the NHS. Previously, we're very much focused on the where, which is, for example, a particular nightclub or pub. But what we're now doing is we're being able to look more closely at the individual and their circumstances and what they need in terms of support, helping them move away from difficult situations. Increasingly find that people from poorer neighbourhoods, people with less education, people who drink, with mental health issues, tend to be vulnerable. We've gone further than that now. We're also finding people with ADHD and learning difficulties and personality disorders are also are more exposed to violence than perhaps what we would expect. But the highlights of what we've achieved for me personally is actually seeing the difference in the real world. Examples are we've helped innovative services be introduced through the NHS, the classic being alcohol treatment centres, somewhere where those who drink to excess in the city centre can go and sleep it off, but with the relevant care of experienced clinicians. That saves them having to go to A&E. We're currently looking at violence prevention teams in emergency care. So they go out and find people who've been injured in violence. And what we're showing is they actually improve patient health, they reduce load on the emergency department, and they save the NHS money. And what's particularly wonderful about all this is we do this at very little cost. We're able to attract some premium funding externally. Very, very keen that we grow our collaborative network. We already have a healthy set of collaborators here in the UK and overseas. I'd like to consolidate that and really broaden the team a little bit more and think through about the depth of expertise that we have on board. We've got some fantastic people working with us. I'm very keen to support them and grow their careers, because really that's the future of violence research and the future of doing something productive in that space.